Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, the pandemic has left several families broken. Each statistic on the death toll that you see is actually somebody's mother, father, uncle, aunt, a friend. In worst cases, somebody's only family member. And while we're all trying to grapple with this problem on our heads right now, the hardest hit are the country's children. So today on FYI, we talk about them and we hope to listen from them. Our phone lines are now open, and if you are somebody in distress or you know somebody who's in distress, you can call in and we'll have our experts answer some of your queries. You can call in on the number flashing on your screen right now. It is 8377088377. Let me just repeat that for you, 8377088377. Now, generally on FYI, we bring you explainers, but when it comes to emotional support for kids, there are no easy answers really. Every child is unique. So today, we are trying to tell you that we're all grieving and do not feel alone, because FYI is here. We are going to listen. Like I said, if there are kids watching our program right now who are feeling distressed, if there are parents, neighbors, family members, concerned friends watching our program right now feeling distressed, call us and we'll help you and guide you on what to do in this massive hour of need, especially for the kids in the country. Let me introduce my guests now. We've got Dr. Amit Sen joining us. He's a child psychiatrist. We have Prabhat Kumar joining us. He is also an advisor and child protection person at the Save Children India. We're hoping to hear from them what exactly the answers are and some tips really that can be shared from people. And then Dr. Sameer Dalwai also, who is somebody who's also working with the kids at the moment. Let me take my first question to Prabhat Kumar at this point, who's an advisor at the Save the Children in the country. Prabhat, we talk at a time when we are seeing a lot of SOS calls online as well. We see a lot of distress calls, people calling us and saying that, well, the entire family has either lost the battle to COVID or still battling COVID, and kids are at times left home alone. In worst case scenarios, left as orphans as well in this really tsunami of COVID that is breaking out in the country. To those kids right now and to those in their support system, what is some of the key things that can be done at the moment?
I think children are one of the worst sufferers of this crisis. And coming to the point that what can be done for these children, I feel that currently when they are seeing that their family members or they themselves are suffering from this health crisis, there is also issue of who will take care of them. This had already come as one of the big concerns, and when we have seen there is surge in number, both the death toll and total number of COVID cases rising, there is big uncertainty. We have seen from our own area of work, we received a lot of SOS calls where children have been left and their parents have gone to hospital. Some of children who have lost their one of the parents, which is very unfortunate, and that is time when they need maximum care and protection. So one of the things we are asking is that there should be institutional mechanisms. So who do they reach out when they need support like this? So children needs to be taken care of. Their key need is the immediate care and protection requirement. They also need food, other essential services. There is need to have enough network of carers who can provide such support in absence of parents.
Prabhat, let me put it this way. How does one reach this network? How does one seek help at this point? And just to point out for our viewers also at this point, we're constantly giving out numbers for people to reach out to. Right? These are flashing on the bottom of our screen actually at this point. These are numbers from the National Commission for Child Protection in the country, specific numbers for Delhi as well, or for anybody experiencing anxiety. There are people who are ready to listen and they can reach out to them as well. But specifically, you know, kids are not very easy to sort of cut across, especially at a distraught time. So some key tips that you can perhaps share with us, Pradhat, at this point on things that the support system around them, even neighbors, if they are temporarily taking care of them, can do?
So, key tip here is one of the things that, like you gave example of National Commission for Protection of Child Rights or Delhi Commission for Protection of Child Rights. It is now duty of each and every state commission for protection of child rights in each state and at national level set up helpline where such children or their neighbors can reach so that these children can be tracked. Okay, so children whose parents are in hospital or isolation, or children who have lost their parent, and then they need to be referred to district child protection unit or child welfare committee. One of the numbers they can also reach out to the child helpline number, which is Childline 1098. They can reach out to them. What we have been doing at certain places, we have been making the roster of such caregiver or the community, extended community members in those community where cases are high, so that those can provide care and support to such children while the parents are away, or long term we are also thinking of linking them to sponsorship and other programs.
All right. So there is a roster being prepared. You can actually reach out to Save the Children on various social media platforms, and they're also happy to help, is what I'm told as well at this point. Let me bring in another expert now. Dr. Amit Sen is joining us. Dr. Sen, the problem with this issue is that we don't have a statistic. We don't have a number that we can look at. So we don't know how many kids are there in which all areas. So instantly to have sort of a network of help for them is a bit of a challenge. At this point, who all can step in and what can be done?
So, my views are a little different from Mr. Prabhat. I think the infrastructure, which the state-run infrastructure, was already insufficient for looking after the needs of children in the country, whether it be NCPCR or DCPCR. In some places like Delhi, they are functional, but in most of the country, they are wanting, and they, even during normal times, in pre-COVID times, and I do work with lots of NGOs and children who are marginalized are in need of such care, and my experience has been that the care from them is less than satisfactory. So to be able to respond to this kind of crisis with such of such magnitude, of such intense suffering, is, absolutely beyond the capacity of whatever rudimentary structures there are, which has been state-run. And the reason for this is because child mental health. Yeah, so I just wanted to also highlight this: that child mental health, there's a blind spot for it. I don't think many people think of it at ordinary times. And now, of course, it's come in a big way. So who can help? I think that we all have to respond as a community. I think everybody is a stakeholder, because what we are looking at, the scale of it might damage this whole generation in a manner which might take years, decades, or generations to recover from. So what we're looking at is not just a tsunami. You mentioned tsunami. Tsunami or an earthquake is a one-time event. It comes and goes away, isn't it? And it leaves us with a lot of death and destruction for us to tackle and to deal with, right? Whereas this is an ongoing thing. We never know when it's going to stop. So it's like an endemic war zone, but across the world. It's global, and there's a constant threat of deaths, of families breaking up, and now it entered everybody's household. So with the first wave, it was still at a distance, and people who were maintaining distances, at social distancing, etc. Many of them felt they were safe if they could do that. But now there's nothing like that, right? And especially kids who have got affected directly. And by that I mean that not only kids who have lost a parent or a family member to COVID or have to be hospitalized, even the ones who have had people, who are living in the family, in the premises of their homes, who have contacted COVID. It's a terrifying experience because they're reading news all the time. They're listening to, what's happening around them. They're bombarded with social media.
There's also this
number of
vicarious
deaths, the funeral pyres.
That is so collective to all of us, I guess, and is impacting the kids the most. In fact, let me just take my first caller now.
Sure.
I'm told I'm joined by G. Krishna from the National Capital. Please go ahead with your question.
Hello.
Yes, Krishna, please
Hello.
go ahead with your question.
Yeah, this is Gopala Krishnan.
Yeah.
My question is, when the vaccines generate antibodies that fight the virus, why is it not a part of the treatment?
You mean for kids? Why is it that not being used for
not
kids?
just for kids, for the patients as in general. If the vaccines generate the antibodies that fight the virus, why is it not part of a treatment that is administered to the patients who are in the hospital?
Okay, that's more of a medical question. I'll take that up. But I see Dr. Sameer's hand going up on that. Please, do you want to comment on that? Can you unmute yourself, please?
Sorry, let's answer the gentleman if you don't mind,
Yeah,
though it's
please.
not related to the topic.
Yeah.
The issue is that any vaccine takes weeks to generate antibodies. It's not an immediate response.
Right.
And that's the answer why it cannot be given as part of the treatment.
Right. Okay. Let me also go back to actually Amit on the point that he was making. Amit, everybody,
Yes.
I think at this point understands the gravity of the situation. I'll just come back to it in just a bit, just to add on to it.
Yes, absolutely. I was going to.
Really,
and if you allow me.
Yeah, if you can just take on one more question before I come to you. Lots of social media at this point is filled with SOS calls. There was one really distraught one which said that the child is left alone as the father has died due to COVID. The mother is still battling COVID inside an ICU. The child currently is in the care of some neighbor, but we don't know what the future is going to be like. And lots of help actually came in their way. But I'm just trying, and I'm sure it is much worse for kids who are, say, not very well off. And for them, there is a larger looming question of safety as well. How does one deal with that situation?
So can I respond to that?
Yeah, please.
Yeah. So see, again, I think I'm not. Although I have questions and some doubts about the responsiveness of the state-run services, I would consider a lot of the NGOs very, very proactive in this space, and I would urge them to maybe take cognizance of some of these desperately isolated and traumatized children who have lost both parents or who have no support system. However, of course, there are many others who might be able to, at least the adults around them might be able to come together to support them, whether it be extended family, immediate community and neighborhood. I know of groups of school parents who have come together right now to support each other. There are social media groups which are supporting each other in terms of, emotional safety and well-being. So all those things can be looked at, no doubt. Again, there are many specific things one can do. And I do have many ideas about what parents or families can do together to be able to keep their children relatively safer and not get affected by the trauma in such a profound way. But I'll come to that later when those questions come.
No, please do. I have to take a break before I take the other caller, but do tell some quick tips that people can actually follow.
All right. So here it is. I mean, the world is in chaos completely, and they have this huge threat which might take away one of their parents or family members, out of their lives. And what we need to do at this point in time is to keep the rest of their life as stable and as normal, if you like, as possible, which means to be able to firstly compartmentalize these areas, which in any case, the isolation takes the person away, but to shield particularly the young children from the bombardment of information that comes through TVs and social medias and the conversations at home, to make sure that they do not become party and listen to them all the time. The older kids, on the other hand, would want to know, and then make that safe emotional space where there can be conversations, where they can be listened to, where they can ask questions, speak about their fears, so that in a very non-judgmental way, we can begin to understand that. But again, I would strongly, go with a word of caution that don't do it all day. Have brackets or have windows in the day, let's say once morning, once in the evening, when you sit together, talk about what's happening, talk about the individual who is in question, what kind of medical help this person is getting. Give them lots of reassurance that we are all there with you without making false promises, mind you, and give them facts and details that, this test was done, that doctor came, this is the prognosis, and this is the kind of support we are giving your parent. Of course, the large majority are recovering and so on. And, but at the same time, make sure that at other times there are, other things to do, like make creative spaces, help them to connect with their hobbies. Maybe watch a movie together and this is for the rest of the family who are still there together, extended family coming into support them at this point in time. One of the things that actually helps this situation of helplessness that you feel, and again, I just wanted to emphasize that the more helpless you feel, the more the effect of trauma, the more damaged you become, right? So if you're able to feel a sense of control in this whole, despite the chaos around you, then the children feel safer. So to include them in the decision making at home, to have a certain structure, to have a certain ability, cook the meal, eat it together, have a time where you can sit down, and maybe have some conversations which are lighter, right? And for the older kids, to engage them in activities where they take responsibility, and if they are able to help other family members, the younger children in, at home, then that's a healing process, because their helplessness goes away. They feel that they can help. It gives them agency, you see.
Let's take a pause over there, because you've said a lot of things. And if I understand you correctly, you're basically saying for younger kids, ensure that normalcy in life continues, but also have these check-in moments where you check on with them on how is the day going, and if they want to talk about something. For older kids, involve them in decision making, and that could come handy as well. I have lots of callers coming in now, but we'll take up that on the other side of this very quick break. Let's straight away take our next caller now. This is a gentleman calling from Kanpur. Please go ahead with your question, sir.
Yes, good evening, Sonal. Thank you, panelists. Last time when we had, I am in the education space, last time when we had all these first wave coming through, we had just about 10% of our teachers directly acted upon by COVID-19. Now we have well over 50% of our teachers directly, indirectly, their family members all impacted. And because of that, they are unable to talk to the students the way we want them to. And we find that the children, when we speak to them, are too stunned to respond. They are hardly responding with everything going around. How can any panelist explain to us whether it is a young child or an older child? We are finding it very difficult to penetrate through to them. How do we tackle them? Thank you.
Right, good question there. Prabhat, do you want to answer that?
Yeah. I think what we have seen, and this picking up from what we have earlier also said, that one of the things that we can do is engaging more with children. Okay, this is very important. And whenever we are expecting anything from anyone, like gentleman was giving example of how teachers are impacted. So remember that everyone who is service provider is also going through some of or the other problems. So it is important to take care the psychosocial needs of caregivers, children, and people who are service providers also.
So, Dr. Amit Sen, I think what he's essentially asking is that there are people wanting to help, they just don't know how to cut across.
Yeah. So, it's not, firstly, to accept that this is an extremely difficult situation, right? And it will affect, people across the age range in very profound ways, and children the most, no doubt. So, as it is, children find it difficult to talk about emotions in front of strangers or people who they don't know very well. And in times like this, that level of trust and their faith in the world around them, that breaks in any case. So it's very hard to do, to start with it. Yeah. So we have to create emotionally safe spaces, which means we have to periodically, regularly meet up either with a small group of children or with one child and listen deeply, which means that, talk about our own issues in terms of what's going on, going on around the world, how, for instance, personally, I'm affected without, of course, in moderation though, and not as if that is it's making me so anxious that I can't function anymore, but in moderation. And that might help the child to begin to open up. And that safe space has to be, modulated in a way where the child is able to talk and be heard without any kind of judgment or immediate solutions or suggestions, where just the fact that the child is able to verbalize or in any way communicate what they're going through is appreciated, is held, is validated, and there is a degree of empathy. And even when we talk about empathy there, that empathy needs to be controlled, because if we start again getting very, very profusely anxious or disturbed about what they're sharing with us, then that again will shut them down, right? So it is indeed an art and to do, and there are some teachers and some parents who do it wonderfully well. Now, it may be a good idea to figure out in schools or in in these kind of spaces where there are communities. Who are the people who can do that effectively? Because we can't get experts everywhere. As it is, we have a huge paucity of experts in our country.
And I think the challenge also this time around is that you're not meeting them physically, right? So it's all happening on the telephone or on video calls, and that is also a challenge. We're completely out of time, so sad to leave it here at the moment, but we'll continue this in our upcoming episodes for FYI as well. So do send in all your questions then. See you later. Bye-bye.